Hello and welcome to the VBAC Home Birth Stories podcast. My name is Ashley Winning and I'm the founder of the Motherhood Circle and the creator of the Journey into Motherhood program. Are you wanting to learn more about vaginal birth after cesarean section and find your confidence to birth the way you feel is the best and safest for you and your baby? Spending too much time worrying about the what ifs and questioning if your body is capable of vaginal birth? Well, that's about to change. This podcast is for women wanting to learn about VBACs, especially home births, and for professionals who want to learn more about how to support VBAC women home birthing. Nothing is off the table. I invite you to connect with yourself, find your own voice and strength to create this pregnancy, birth, and motherhood experience you desire. You totally deserve this. If we haven't met before, let me tell you a little bit about me. I'm a mother of two, I'm a doula, a motherhood guide, and have had 2 unplanned and unneeded cesarean sections. And I'm planning my first home and vaginal birth, so it'll be a home birth after 2 cesareans. I'm here to support you along your journey to discover and create your positive pregnancy, birth, and motherhood story. So feel free to reach out at any time if you want support. Now let's get started. Hey, me again. I just wanted to let you know that I've just created a brand new Facebook group called VBAC Home Birth Support Group, where you can connect with other like-minded mothers who are looking to have a VBAC home birth as well. You can find the link in the show notes and I look forward to seeing you there. Hi, Alyssa. Thank you so much for coming onto the podcast. I'm really excited to hear your stories. We've been in connection through the VBAC support group, the Australian support group, and also the home birth group, and I think some others. So it's been really great to actually see you face to face and now get to hear your beautiful birth stories.
Oh, thank you. I'm really excited to be here. Yeah, I've been part of the VBAC group since not long after I had my first baby in emergency cesarean after an induction, and it's been really helpful. And then I joined the home birth group not long after that and just learned so much.
Oh, that's so good. Well, let us know a little bit about yourself.
My name's Alyssa. I've got 2 children. I've had 3 pregnancies. I had a miscarriage for our first pregnancy at about 10 weeks. The sac was a bit small on the ultrasound, so my GP prepared me and that's what happened. And, you know, it was a bit traumatizing to begin with, but we got through it and we had a baby. We actually fell pregnant a couple of months after that miscarriage, so it wasn't very long between, with James, who was my first baby. And we lived down on the Mornington Peninsula in Victoria, so right down the bottom, southeast of Melbourne.
Awesome. Are you still there now?
Yep, we live here. We own, 5 acres. My family bought this 20 years ago and we decided to buy in as well.
Lovely. And how are you going with the COVID situation at the moment down in Victoria?
Oh, just getting through. At least we've got some space outside to run around for James because he's 3 now. So he's just hectic. But yeah, we're getting through. I mean, we've probably only got another 2 weeks and that's it. Hopefully that'll be over.
Hopefully. Oh, that's good. I'm glad that you've been doing well in that time. So let's start off with James's pregnancy and then birth story.
Okay, so I fell pregnant with James a couple of months after our first pregnancy ended in miscarriage. And I had all these really normal ideas about birth and how I would get through labour and I would get a baby at the end. And I knew that I didn't really want interventions and drugs and stuff, but I didn't really look into that in hindsight. Like I just said, I don't really want that. And that's where I left it. So I fell pregnant and I took a pregnancy test and I went to my GP and I had my blood test done. And he is actually a shared care provider with our local birthing hospital, which is about half an hour away from where we live. So here is a closer one, but they closed their birthing unit 12 years ago or something now, where I was actually born. And so we just trudged into normal standard pregnancy care, I suppose you could call it. Everything went along textbook. I had a 12-week scan, I had a 20-week scan. I was a bit anxious because I'd had the miscarriage prior to conceiving him. So it was a bit hard to really get past okay, I'll just make it to the end of this week. Okay, I'll just make it to the end of next week. And it wasn't really until I started to feel him moving at about 19 weeks or 20 weeks And that's when I really went, okay, this is actually happening. We're actually going to have a baby.
Definitely.
It
becomes
was
so
just
real.
really normal. Yeah, so it was just really normal, average pregnancy. There was nothing that I passed my GTT. I did all the blood tests. I did everything else. I had a little low iron, but not enough that my doctor went, oh, you need a transfusion. So we just left it and it came up, I presume. I don't know. So I didn't actually see the hospital until 24 weeks was my first intake appointment with a midwife. And I had to have a second scan because the 20-week scan because they didn't get enough pictures of his heart. So that was just double checked, and then he was all fine, nothing wrong with him. So we went on. We found out it was a boy, definitely. Definitely. It was a big ultrasound picture of just the V of his legs and a really good crutch shot.
Yeah.
It was actually so funny because the first ultrasound tech was like, oh, it's a boy. And my husband's like, is it actually a boy? He's like, oh, 80% I'm sure it's a boy.
80%.
Well, yeah, that's not really reassuring. You want to know definitely, right? If you're going to know.
Definitely.
Yeah, so I didn't see the hospital again until about 37 weeks. And my GP actually went on holiday. He usually goes overseas and does some work over there. He's like a male in his 70s. Like, he's the most active GP I've ever known. So he went away overseas and he said, look, now you're going to have all your appointments at the hospital anyway. That's what they want. So that's what you'll do. So that's what I did. So I had my appointment at 37 weeks, and the registrar, which I believe are training OBs or the lower level obstetric type people.
Yeah.
I didn't see another midwife after that. I only saw a OB. And she said, oh, how's your GD going? And I went, what?
Oh, so
and I went, I don't have it though.
With...
And she's like, oh, it says you're on your file. What you do? What's your name? I said Alyssa, and she said, "Oh, this isn't your file." She'd actually had the file on the computer from the previous patient, and I was like, "Well, this has really started out well." I already felt uneasy after that, and I just felt like it just was going to get worse from there, and it kind of did. You know, she did all the things. She did a lot of tapping on the computer, not a lot of looking at me, just asking me questions and tapping away on the computer. She didn't really have any emotion in her face. She didn't really look like she wanted to be there, realistically. But yeah, so we moved on to
Can I ask you, Alyssa, did you have a high BMI or any other risk factors or anything like that?
So I did have a high BMI, but my GP didn't say anything about it. He's known me since I was born. He delivered me at the local hospital. Like, this is how well I know that GP.
Because you had a personal connection with the GP. He saw you, he knew you. Whereas when you went into hospital
he knew my health.
They saw you and perhaps boxed you in a category, do you feel?
Absolutely. Okay. Absolutely, she did. Straight away, she was looking at the files once she brought up the right one. Looked at my weight. You know, I was weighed at the GP often. No one said anything about my weight. My blood pressure was fine. I passed my glucose test. Like, I was sweet. I was ready to go. I was happy to wait it out and just see what happened. But I didn't have my GP to go back to after that. So when she said, oh, well, you've got a high BMI and your baby's measuring 42, 44 weeks at 37 weeks. I was like, what? She's like, okay, well, we'll book an induction. And I went, whoa, hang on. After a fundal height measurement, I was pretty sure that I was measuring 2 weeks ahead anyway, which my GP said was fine, was normal, which I do know is normal now. And she was like, oh, yeah, we'll book an induction because you're measuring way ahead. You're going to have a big baby. I went, okay, well, how about we have an ultrasound first, because I'd like to have a bit more information than that. I really don't like the idea of just booking it because you said so. And she said, okay, so she booked the scan. So I went and had the scan at the hospital the following day. And James was measuring 10 pounds, give or take a pound each way. No one gave me the information about the pound each way, which is really important to me because my mum had 2 9-pound babies and then twins 7 pound each. They were big babies. You know, like, this is what my mother has and my line has done.
Yeah, which is totally normal. And I think a lot of people don't take that into. My nanny had 9 and 10 pounders and she is not even 5 foot. She's tiny.
Yeah, and so I'm 5 foot tall. My mum is 5'1", 5'2". Like, we're not big people.
Yeah, exactly.
And so it's all belly. It's not, you know, we're not hiding it in our frame anywhere.
Yeah,
that's for sure. But yeah, so, you know, she's like, all right, book the scan. So we went to have a scan, measured 10 pounds, got some cute pictures because it was just me. My husband was working. So I was at that appointment alone. So the next one, I went the following day, must have been a Wednesday, I think. Saw a higher up OB, senior team, I believe she said. And she said, okay, well, he's measuring over 10 pounds. We'll book an induction. If it was me, I would just have a C-section now. And I just almost lost my shit right there in the room. I nearly cried. And I said to her, you know, well, I really want to have this baby as naturally as possible. And I said it over and over again, and she didn't acknowledge it. My mum was there. My husband was there. My mum said, do you really think that's the best thing? And she said, yep, if it was me, I'd have a C-section. I wouldn't even bother with induction. So we booked the induction. That's what we were told to do. So that's what we did. I felt like there was no wiggle room. I felt like there was no way that I would possibly have this baby naturally, because she said I couldn't. She just said, oh, well, you might have a risk of shoulder dystocia too if he gets bigger. But she didn't really say what sort of came after that. You know, would my baby die of shoulder dystocia? Would I die? You know, is there other complications? Or is it just because maybe he's big and maybe I was laying on my back and that's how he was born? You know?
Yeah,
So,
and also her personal opinion on what she would do is irrelevant,
yeah.
because she's a trained surgeon. So, of course, she's biased towards surgery. Obstetrician said the same thing to me. She had 2 planned cesareans for her births. So, therefore, she thought that, you know, everyone should have these kind of births, which is fine, but we need to keep our personal opinions in check and keep it medical for the individual person. Right. And informed choice and care is actually finding out what the person wants, how many children they want, why they want this, and then looking at, you know, the risk factors and talking about that.
Yeah, exactly. So she didn't actually say there was no percentages mentioned. It was just, let's book the induction. This could happen, this could happen, this could happen. Your baby might die. I heard that at least once, I'm pretty sure, you know, and it was really ringing in my ears. Yeah. So I cried all the way home from the hospital. I knew in my heart that this wasn't right, but I wasn't listening to my intuition anymore. I was listening to the hospital.
Did they talk to you about the risks of the induction at all?
No, and I had a high baby. I didn't have an engaged baby. So there was even a higher risk of cord prolapse. No one said anything about that until I was in the VBAC group and this happened to people, and there was an increased risk associated with induction and a high baby. Like there was nothing said about that. It's ridiculous. So I'm pretty angry about it.
Yeah, quite rightly so.
Yeah, so I think it was booked. So obviously it wasn't immediate. She booked it for the end of the week. I was going in on Sunday. She booked it on a Wednesday. I was going in on Sunday afternoon to have the gel, but get a stretch. And she did like a cervical check at the time, because that's what you do. It's what they do as part of that appointment. And I didn't say no, and I didn't know I could. And so I went to the hospital with my husband, and he stayed, and my mum came as well. I had a pretty good support network. They were there for me. And I went to the hospital and I had the gel done, and I had some cramping and stuff overnight and all that stuff. And then nothing had really changed in the morning. So I'd had 2 doses overnight. And the morning OB team came in at 7 o'clock-ish, 8 o'clock. And she said, oh, you haven't really, but maybe 1 centimetre dilated. Still quite stiff, not really softening yet. And I burst into tears with them standing at the end of my bed, saying, well, do I just go for a C-section now then? Like, what happens? I just thought that if this failed, that I would have to have surgery, that was the end of it. So she said, no, we want you to have this baby. She said naturally, but I just thought that was the wrong word to use. You should have said vaginally, but oh well, you know, this is not natural. You've already interfered. And she said, we'll give you a 3rd dose of the gel, of the, I don't even know what it's called, posterior glandin, maybe softening gel. And yeah, so I had more cramping. I have to wait another 6 hours because they can't do anything hormonally until that 6 hours is up, so it doesn't interact or doesn't interfere with the gel or send the baby into distress. Had to have monitoring for an hour after each gel insertion. I was really tired by this time. I was really tired. It was about lunchtime the following day. So I'd come in the Sunday night. It was now Monday afternoon. She said, yeah, no worries. So the same OB that booked me in for the induction, she came that afternoon. She was on shift. She was on ward. And she said, yeah, I think I could probably break your waters. We'll book it in for tomorrow morning. So I stayed another night.
How many weeks were you, by the way?
Pardon?
How many weeks were you?
Oh, I was 39 and a half. weeks.
39 and a half weeks, yeah.
I think I went in at 39.3 and I ended up being actually induced at 39 plus 5.
Okay, but the process started at 39.
I was in there for 2 nights before we actually got anywhere.
Yeah.
You know, it was a bit disheartening. I was so exhausted, even by the time we just got to breaking my waters and putting a drip in. I was so tired.
It's I went through the same thing myself, and it's just a time-consuming, boring, long-winded process that nobody talks about.
Yeah, and your husband can't stay.
Oh, couldn't he? Oh,
no, because I was in a shared room, so there was no space. He stayed because I remember we watched The Block like religiously every year. So The Block was on that night, the night that I went to the hospital. It started that night. And I was like, oh, this is great. He can stay. We can watch this and then he can go home. You know, we had a dog at home. He had to go home. And I was sharing a room. So, you know, the rules were your husband couldn't stay. No one could stay if you were sharing a room. So he didn't. So we came back in the morning. And so I rang him at 6 o'clock, at 6:30, and I said, you better get here because they're talking about breaking my waters and moving me to the birth suite now. This is at 6:30, 7 o'clock in the morning. So just before shift changeover, or as shift changed over, I presume. Yeah, so I was tired. I was excited though, because I'm going to meet my baby. And I wasn't really explained the induction process other than breaking my waters and putting a drip in. That was sort of all there was. I was given like a sheet of paper with information on it. I didn't read the sheet of paper that well, obviously. It was just a standard photocopied piece of paper on induction. And at the top of the piece of paper, I should add, it said, spontaneous labour is generally always best.
Yes, those papers can be a bit daunting, can't they? And plus, you know, there's nothing beats someone sitting down, looking at you in the eyes and explaining things and asking you if you have any questions or concerns, you know, and actually talking through the process.
Yeah, not just a 10-minute appointment where this is what we're going to do. Okay, we'll see you then.
So did they put you straight on the Pitocin?
Yeah, straight away. So
they broke your waters and straight up.
Yeah, so I was laying sort of back on the bed or sort of a little elevated, I suppose, and the obstetrician broke my waters with I think it was like a hook. Actually, because I'd had my birthing classes, the hospital birthing classes the weekend before at 38 weeks. So this was all kind of fresh in my head. And that was a midwife, an older midwife, who quite liked natural birth. She didn't like the interventions and stuff like that. So it was interesting that all of these things that she talked about were now happening to me. When I didn't want that, you know, that was not what I wanted. It's not what I envisioned. But in the lead up to my birth, I couldn't envision what birth and labour was going to look like. And so I think my intuition knew that there was going to be some interference because I couldn't see on the other side of birth. I couldn't see lifting my baby up and bringing my baby to me. I couldn't see any of that. And I'd seen birth. I've attended births of my girlfriends years before. You know, I've seen baby born, and I couldn't imagine that for myself. So I think I knew way back at about 30 weeks, 35 weeks, that something was going to happen to me. So yeah, I had the drip put in, had my waters broken, and I said to her, oh, is there a lot of water? And she said, oh, more than average. And I went, yeah, I knew it. I knew there was more water than there actually was. Maybe that magnified my baby a little bit, you know, who knows? And and it was warm, and I didn't think about the water being warm. I thought it would be cold.
I know, it's so nice, isn't it?
I laughed, and she was like, what's wrong? And I went, it's warm.
Yeah.
It's warm, yeah. So
like being in the ocean. It's like because I've got Wet and Wild down the road.
Bath.
I'm like, it's like this bath of waters is like a tsunami of waters. It's like explodes everywhere, and it's like, woo.
Yeah, exactly. And it just everywhere, all over
does,
the bed. I'm not even sure who cleaned that up. I don't even know.
I know.
I wasn't watching. Because there was a lot.
So much is happening.
Yeah.
Were you in any discomfort or anything when that happened?
No. It's the VEs that were really uncomfortable. And by this time I'd had 1, 2, 3, 4, 5 already. And it's already day 2. That's a lot of people a lot of different people touching my cervix, you know, and obviously that just continued. I had about 10 or 11 over the whole process in the end. That's a lot. I'm astounded at allowing that to happen, I suppose you could say. But yeah, so I stood up, I sat down on the football, I moved the bed a little bit so that I could lean on it. My mum, we were watching the morning news. My mum was there, my husband was there. They brought breakfast in. I ate a bit of breakfast, fruit and yolk, because I thought, I don't really want to eat anything heavy in case it comes back up, which was true. It did come back up down the road. So yeah, and just waiting, just cramping a little bit, having a bit of period pain type cramping, and it moved in. And I don't know where along the line, but they turned into contractions, and they were just on top of each other, bang, 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 in 10 minutes, and then a big break. So it wasn't really going anywhere at all. And I think the notes say about lunchtime is when I was in established labour or active labour. I don't even know the words that they use, labour of some description. So what was that, about midday, 1 o'clock? I was coping okay. It was painful. There was a lot of pain in my bum because my baby was posterior and no one told me. No one decided to tell me that my baby was turned around not the wrong way, but the other way, the not the best way. And yeah, so he was pushing, the back of his head was pushing straight into my rectum, and it hurt. And that took all of my focus away from dealing with the contractions in the end. I just couldn't deal with that pressure. It felt like rocks in my bottom. It was just so, I could remember it like it was yesterday. It was so painful. And yeah. So, where are we at lunchtime? And I had all the things strapped on. I had the drip in my elbow, so I couldn't bend my right arm. So it was shoved up in the bottom of my elbow. And I just went, this is a bit shit. This is a bit shit, this position that I'm in, with 2 belly bands and one of the little scalp screws in his head. I don't even know why I had the belly bands on.
Yeah, that's interesting that you had those on in this.
Yeah.
In the actual. And when you say elbow, do you mean on the outside or the inside?
In the inside of my elbow.
Yeah.
Just about on the top of my forearm. So if I bent my arm,
it was painful.
It would just kink the thing, and then the thing machine would beep, 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 because the thing's not flowing in properly. So that was really concentration breaking as well, because that happened nearly every other contraction, because I was just trying to focus and breathe through it. And then I was making a bit of noise, and the midwife said, I don't even know if this was the same midwife as I started with or a different one. And she said, I didn't even know whether they were in the room or not. I have no idea. And she said, probably just need to conserve your energy, just quieten down a little bit. And in my mind, she said, shut up, you're making too much noise.
Yeah.
And I went, and I just got on the back foot from there. And then I didn't cope after that because she'd interrupted me.
Yeah.
And I was just thinking about concentrating, not making too much noise.
And you were being a naughty girl. So
yeah,
you were in the area.
Yeah, and I wanted to go to the toilet, and I had to ask to go to the toilet, and because I was convinced if I just keep my bladder empty, he can move down. It's fine. I knew that. I knew that my bladder could get in the way. But yeah, he, not that I could feel it, but the idea it was that my contractions were coming 1, 2, 3, all in 10 minutes with a couple of seconds break, and then there'd be a 15-minute gap. And then, so he'd just end up back up high again. He wasn't really coming down at all. He wasn't descending. I don't remember anyone touching me and feeling where he was. I'm not sure. I can't remember that at all. I don't remember a lot of what happened over that sort of first 10 hours because I just remember those contractions and being tied to this post and this table and this bed, stuck beside the bed. But yeah, so we got to about 5 p.m., 4 p.m. And the midwife said, oh, do you want to have an epidural? I don't think she said anything about gas or whatever the injection was or the sterile water injections or anything. I think she just said epidural. I don't think she offered me anything else. I don't remember if she did. I feel like I would have taken something else over an epidural though, because I knew that that's not what I wanted. But I said yes. I said yes, that's what I want. I want to have a rest. And then we can get back to doing this a bit later. So she got the anesthesiologist. He came in. He was speaking to me, and all the lights are on now. When he's in there, all the lights are on. And he's telling me about the epidural and the risk or whatever. I don't even remember what he said. And I had my eyes shut. And he said, are you listening? I said, yes. I'm just very tired. So I've shut my eyes. And so he came back, and then my husband hopped out because he doesn't like needles. He can't deal. And they didn't want everyone in there anyway when that happened. So my mum stayed and sort of held me in that prawn curled over position over a pillow. And the local went in, and that was fine. I could deal with the local. And I've had local before because I have an implant on prior to conceiving James. And and I was so prepared for it to hurt when he said local anesthetic. And it was fine. And then the contraction came. So I had to stay really still while that contraction came and went, that mechanical contraction. And he put the epidural in, and it's like my legs melted straight away, almost instantly. It worked really well. It was very effective. They put a catheter in and all that comes with the epidural, but they laid me down flat on my back, I'm pretty sure. I don't think I was propped on my side. I definitely wasn't right all over on my side. I was on my back, and I don't know if there was a pillow under one side or not. I can't remember. I was a little bit inclined, so my legs were down a little lower than my head, but not noticeably much. I just knew that I was a little bit because that's the way the bed was set up. So we stayed there for 4 hours. I had a rest. I had a bit of a nap. And the midwife said, Alyssa, can you just breathe through your mouth, please? Your oxygen level's just a bit low. So I breathed through my mouth for a little while, which I couldn't sleep like that anymore. And the room was nice and dark, and I could feel the sensation of the contractions, but I couldn't feel anything else. I couldn't even feel if I touched my stomach or my legs. I couldn't feel that at all. And then I just laid there for 4 hours. So what is that, 6 o'clock till 10-ish? And then the obstetrician came in. It's night shift now. They've changed over again. And she said, well, you've only dilated with 1 more centimetre. That's right. Sorry, go back. I started at 1 centimetre at a stretch. I got to 4 centimetres by 4 or 5 o'clock. And then while I was 4 hours on an epidural, I only got to 5 centimetres at a stretch. Like, I think that probably I was less than that, even though she said 5 centimetres. And I was pretty sure in my mind I'd made the decision if I was less than 7 centimetres, I was done. Because I felt like I couldn't go anymore. We can have a cesarean now, or we can wait another 4 hours. She sounded kind. She smiled. She spoke softly. She had all those elements, but I even said after the birth, she was kind. She was lovely, but I don't think she was in the end. So I had the cesarean, and they took all of my jewelry off. I couldn't take one bangle off, so they taped it to my arm. I had to move beds. My husband nearly burst into tears. It was not what he wanted at all, even though it was a very real opportunity from the induction anyway. And I knew that, and I was prepared for that, but he was not. And my mum was still with us, so it's 10 o'clock at night, and the nurse has changed over again. So we've actually got a nurse midwife now, so one that takes us down to theatre, and she was in theatre as well. So I changed beds. I had to move myself over, and that's really fun when you can't feel your legs. I sort of had to lift one leg over and then shuffle my bottom over and then lift the other leg over. I couldn't feel anything by this stage. There was no more contractions. The drip had been taken off or turned off, and my cannula had just been left where it was so that they can put the whatever else in when they get down there. So it's not on the same floor. Obviously, I go out the maternity ward doors, and my husband stayed in maternity, and my mum came with me because she'd had a cesarean before with the twins, with my brothers. So they decided, I said to him, it's up to you. I'm not going to force you to do something you can't do. So he decided not to come, which, I mean, that's heartbreaking to start with, but it was his choice, and I think he regrets it, but I think that he's probably better off for it as well. I don't think he needed to see me that way. So, sorry, that's very hard, isn't it?
No, that's okay. I got tears too.
Yeah. Every time I listen to a podcast about birth stories and about C-sections and they end up like this, and I just go straight back there. So, yeah, I go down to theatre, and on the way to theatre, the lady says, or the orderly or the nurse or whoever's taking down the information on the clipboard, she says, do you wear contacts or glasses? And I said, yeah, I've got contacts in. I'm already on the way to theatre. I can't turn back and go and get my glasses, so I'm essentially blind. by the time I get into theatre. They strapped my arms down, and obviously where my IV was, they put I don't think I had a hairnet on. I think they just left it.
Why did they
tied
strap
back
your
anyway.
arms down?
I have no idea.
I haven't heard that before.
But well, because the IV was in my forearm, so my right arm was definitely strapped down. I don't know where my left arm was, actually, now thinking about it.
Mm-hmm.
I think I had one of those finger pulse things on,
Sure.
though, like
Yeah.
the heart rate.
Mm-hmm.
I think that was on the other hand. I had nail polish on, which is a big no-no. I had, what was it, shellac or something. She was not impressed about that. Well, I wasn't preparing for the cesarean the week before. But, yeah, so playing in theatre, and they bring my mum in. She's in a gown and a hairnet and all those things. And no one's really talking. I can hear some music. I can hear the anesthesiologist, Theo. He introduced himself to me, and he's the only one that really spoke to me throughout the whole process. And it was about 11 o'clock by the time we get down to theatre at night. So, you know, it's quiet. There's no one else around. I remember moving from the bed that I was on to the table where I was going to be operated on, and the orderly said, "Don't move, we'll do it all for you." I went, okay. We just had to say, "Don't move, it's all right, we got you." Could have been nicer about it, but okay. So laying on the table, and the anaesthesio was telling me, "Okay, can you feel the cold back here? Can you feel it here?" And I said, "No, I can't feel it at all." And he's like, "Oh, that's great. The epidural is working really well." And by this stage, I'm shaking from the epidural. I don't know if you had an epidural yourself, but it's quite violent shaking by the end of it.
Yeah, so many women from, you know, just doing these podcasts, so many women are shaking in the theatre because it's like cold and the drugs are so strong. And
yeah, well, I don't remember feeling cold, but I was already shaking a little bit when we were in the birth suite from the epidural, I believe. And I was laying flat on my back again now, and couldn't see. I didn't have my contacts in. And I'm not super blind, but I'm blind enough that I can't make out shapes that are further than sort of 30 centimetres from my face.
Wow.
I couldn't see anything.
Yeah, that's
It was all
hard.
blurry. My mum's talking to me. She's sitting on my right, and she's talking to me, and she's saying, "Now you might feel like a thawing sensation." And I was just numb emotionally now. I just thought, well, this is the process now. And by the time I got to theatre, I was done. I was over it. I didn't want to do that induction anymore. So it was the right decision. The induction road ended. But, you know, like there was nowhere else to go, realistically. What was I going to do? Just stay induced and go through that for however long and then end up in C-section, you know, further down the track. I didn't want that. I'd already decided that back in the room. Yeah, so they were chatting amongst themselves, something about during the week or weekend plans or whatever, and no one told me when my baby came out. I couldn't see anything. I just heard him cry, and I burst into tears. And Mum couldn't see him. No one said anything. No one said that he was out, and then he didn't cry. And then they obviously cut his cord and took him over to the table. I didn't feel any of the cutting or anything, so that was nice. I didn't feel any of the stitching up. And so they took him over to the table, and then when they were ready, they said to Mum, "Okay, you can come over and take some photos now." I think the nurse the nurse asked for Mum first and said, "I'll take some photos for you." So she did. She took some photos of him looking all purpley and red and laying on that table all bloated from the amount of fluid that we both had over 16 hours of induction. And so Mum brought him over to me, and she pushed him against my face. He was wrapped up like a burrito. He had the blanket all around his body and all over his head, only his face peeking out. So she pushed him against my face and said, "Here he is. Here's your baby." And no one said anything at all. No one said congratulations. No one said anything. And then at some point, someone said, "Okay, it's time for you guys to go now." So my mum and my baby left me in theatre.
Why did they be told to leave the theatre?
I don't know, because there was no complications. I wasn't losing too much blood. My heart rate was fine. Everything was really routine, and they went, and Mum wasn't allowed to carry him. He had to go in the isolate because you have to go through a public area to get back to the ward where my husband was. So
and she wasn't
I
allowed
missed out on all.
either.
Pardon?
And she wasn't allowed to carry him either.
No, she carried him to a point where they go across that red line or whatever, and then they put him in the isolette because of the public. That's where the public actually come to. So I don't know. They told me about it later. It was a bit weird. Mum actually told me about it. So I stayed down there and I went to recovery. And I was pretty tired. It's sort of midnight now, 1 o'clock. I don't think I got back to ward till 1 a.m. and he was born at 11:20 p.m. So it was a long time. And I got back and he was dressed and he had a nappy change and he had photos taken with his dad and with my mum, and he was there, and I still had, you know, that cannula in my bloody arm. So they laid him down me when I got back to ward, and in my own room, which was nice. But still, I mean, if that's the best thing about it, then it's not really great, is it? Yeah, so I had my first breastfeed, and my husband held his head. I think I sent you that photo, and held his head, and my arm is spread out because the drip is still in there for antibiotics or whatever reason, fluid, I don't know. So he held his head and we got a photo, and by the time they left, it was 3 a.m. So that's all there was. You know, I was left with my baby on my own from 3 a.m. And my husband met his dad in the car park at 10 a.m. and I wasn't dressed. And I had a pretty okay night. I mean, if you can call it a night, I was there. I was awake till 3 or 4. He was a very quiet baby. He was a very happy baby. I couldn't imagine if he was a screamer.
How big was he born?
He was 9 pounds 8 ounces. So he was a big boy. But
yeah, but only 9 pounds.
He wasn't over 10 pounds, like they said. He wasn't going to be 11 pounds at 40 weeks. Like, it all just felt like such a fake reason, which it was in the end. It could have happened on its own, and if I had have had to go for a C-section after a spontaneous labour, maybe I would have felt differently about it. Who knows? Who knows? But I can't change it, but that's what it is. I spent a few days in the hospital.
But it's important that you share this story, because there are other women out there like you who are going through this, and this is happening every single day. A friend of mine shared her birth photographer had attended 100 births, and out of 100 of them, only one of them, which was hers, wasn't induced.
You're kidding.
No.
I mean, I'm not surprised. You know, what's the induction rate at the moment? 40% of first-time mums are being induced?
I don't know. It has to be an extremely, I mean, that's a very high rate, but it's just, especially when first-time mums have such a high rate of cesarean section because they haven't been through the process before. And those things... Because
they're an unknown quantity,
disclose to women, you know, before. They know they know there's a certain risk of a C-section, and they're not, they're not disclosing those risks, but they're happy to share a possible very low risk of a shoulder dissociator or something, you know, dead weight.
Or your baby's going to be
very slim chance of that happening.
Yeah, but why not allow that to happen and then decide how, like, if you don't know how to manage shoulder dystocia, then you probably shouldn't be working in maternity.
Exactly.
Like,
and why not talk about the risk of that? You know, this is the percentage of it. Okay, well, I really don't think that's going to happen to me, or I'm willing to take that risk and we're happy to go through. But do they talk about the risk of the induction, you know, possibly causing that to happen because of the fake contractions pushing them?
No, exactly. No one said that. No one made the correlation that induction has a higher rate of ending in shoulder dystocia or instrumental birth or cesarean. They have the audacity to say, induction doesn't heighten the risk of a cesarean.
I know, they say that.
That's bullshit.
Yeah, so many inductions.
Total bullshit.
Yeah.
So, you know, I stayed in the hospital for a couple of days, 3 nights, I'm not sure. People came to the hospital. I spent the whole first day. So I had my C-section 11:20 p.m., back to the room at 1 a.m. I didn't get dressed or get out of bed until 5 p.m. that afternoon. No one said that I could get out of bed, so I just didn't. I was still in a hospital gown, just covered. It wasn't in it. I wasn't tied up at my back. It was just over the top of me, under the sheets, laying in my own whatever's going on down there, because I didn't know. As silly as it sounds, no one tells you about afterbirth regardless of whether you have a C-section or a natural vaginal birth, there is still afterbirth. There is still bleeding like a period, quite heavily. And no one told me about that. So I wasn't surprised when I got up. I sort of knew it was there. I could feel it happening. But no one tells you. And the one nurse that got me up at 5 o'clock, she said, all right, probably time to get dressed and have a shower. I don't think I had a shower. I think she just wiped me down and I got dressed. She wiped me down on the bed. And she said, yeah, birth's not glamorous. Got to leave your dignity at the door. And I went, okay. And now I think back to that and I just go, my dignity at the door. Wow. Welcome to the hospital environment. Leave your dignity at the door. Ooh,
Lovely.
Pretty ridiculous.
Yeah. And
So,
also, that's like pretty shocking that you were left till 5 o'clock.
Yeah, well, I didn't know that I could ask to get up, you know.
No, but you shouldn't have to, because that's what they're
right.
like, what's the point of being in hospital? That's the whole point, isn't it? That they're supposed to look after you.
Mm-hmm.
And you had on.
And I had plenty of visits from the midwives and stuff over the day.
Yeah, well, exactly.
They came in. I couldn't get out and get my babies, so they had to come in.
Exactly.
He spent a lot of time just on me because I couldn't
Mm-hmm.
get up to get to his. So I was right beside my bed, but it was hard to sort of lift him in. I'm only little and that bed only goes so high.
Yeah.
Yeah. So, it was pretty difficult, and it was when I had family outside the door. She sort of said, "Oh, just wait out there. I'm just gonna get her dressed."
Mm-hmm.
I went, "Yeah, that's exactly what they need to hear." My husband's brother and his wife. That's exactly what they need to hear.
How did you heal from, your postpartum, from the C-section and in postpartum? How did your breastfeeding, if you chose to breastfeed, how did that journey go? And how did your mental health go?
Breastfeeding was really a gift afterwards, I think. I mean, my mum breastfed 4 babies quite well. So I didn't have any qualms with, am I going to be able to breastfeed? I knew that I probably would be able to. And I was prepared to take that. I don't know if it's a risk, but I was prepared to start there and then go from there. So it was really well. He had his first feed at that, 1 a.m. when I got back to the room, and he fed well. And then that second night, once I was actually out of bed, I was up and down with him, and he was fine. And I just fed him in the chair because that was most comfortable. And then I put him back in his bassinet. And then when I got home, I think it must have been, that day 3 where all your hormones plummet or skyrocket, one of the two.
Mm-hmm.
And I cried the whole day. And I came home that morning and I just cried the whole day. And my husband didn't know why I was crying. And we live communally with my mum on this 5 acres. We live in one house and they live in the other house, and my grandma lives here as well. So I was surrounded by support.
Mm-hmm.
And I think I felt safe enough to have that day of just a real low. And baby blues that is so far from describing how it feels. That real low plummet of emotions and that disappointment and that rage of, this was not the birth experience that I really wanted. This was not what I signed up for. I had rage. I was so angry. But so I got through that day, and that night my baby slept in my bed, which was I knew, I was pretty sure was a big no-no. But he just wanted to be on me, so I slept with him, and it was easier than trying to get out of bed to the bassinet all the time with my C-section scar. And then from there, my milk came in, and everything was hunky-dory. He fed like a champion. He had it efficient, and he was feeding for 10 minutes, 15 minutes at the most, and he didn't want to feed every hour. He wanted to feed every 2 hours or 3 hours, so it was pretty regular. It was probably the textbook explanation of breastfeeding to begin with, when they say, they should feed every 3 hours. That's what he did. And he slept in between. He was a wonderful baby. And I just healed. By 2 weeks, I felt amazing. I felt half normal. I could drive my car. I could lift my baby out in the capsule. I was okay. I was healing. Physically, I was healing. But mentally, I was just so wrapped up in what was happening right now with my baby and looking after my baby that I didn't really have time to fully process his birth. It wasn't until I sort of started I didn't even read my hospital notes. I didn't bother because I knew what happened. And I had meconium staining, I should say that, in the waters, but it wasn't on my hospital notes. And it was the same OB that did the C-section as did the breaking my waters, I'm pretty sure. So it should have been on my notes, but it wasn't. And Yeah, he was fine. He was really good. And it wasn't until I was fully healed by 6 weeks and my doctor said, yeah, you can go about your normal life now. And I went, cool, all right, I will. I'll take my baby out for a walk. I'll go shopping. I'll do all the things. I had the luxury of staying home between babies because my husband earned enough money that we could live on. And I worked from home a little bit for my mum anyway at that time, just doing some admin on the computer. So I could stay home. I had that luxury, which was really nice, to spend time with my baby. And he was really happy. Until about 4.5 months when he started having this work of breathing just out of nowhere, really, like it sort of gradually showed up. And so I took him to our local hospital and they said, oh, it's bronchiolitis, even though the swab came back negative. So this is the same hospital he was born at. The closest hospital with a children's ward and a maternity ward. And they said, oh, it's bronchiolitis. We put him on oxygen. So we stayed for the weekend from Friday to Sunday and they sent us home. So we went home and his work of breathing was probably better. But this is my first baby and I'm not medically trained at all. I work in canteen management, like in schools. This is not my repertoire. It's not in my repertoire to look after a baby that's not well but appears well. But yeah, so I took him back again a month later when his breathing had deteriorated again. I've been to my GP the week before. He'd had a chest x-ray already and he said, yeah, there's a little bit of fluid on his lungs, so we'll just clear that up. So we cleared that up. He had a repeat x-ray. There was a bit of a shadow on his x-ray. So he said, look, he's still got that work of breathing. I need you to go back to the hospital. So I went back to the hospital. And this is now the 20th of December. So we've got, 5 days till Christmas. And I'm in the hospital with my baby on his first Christmas on my own because my husband had to work. And my mum came to visit, which was nice. So that was good. But she works school hours, so it's hard to come and visit around those. And so they took another x-ray in the hospital and they did all these things and they did lots of testing with his blood and they took his blood in emergency and I wanted to kill that doctor. And I worked out later that he wasn't actually a pediatrician. He was a doctor on a pediatrician rotation. So he shouldn't have touched my child in the first place. I shouldn't have let him, but he just bled all over the blanket that he was in. So I took him there and he stayed there for 2 or 3 days and they said, we don't know what's wrong with him. He's on oxygen. We have to increase it a little bit here and drop it a little bit there. So we're going to send you to the Children's Hospital up at Monash and go there and they'll sort out what's going on. So they transferred us in an ambulance and the ambulance didn't want to take us because he's only 4 months old. So he didn't qualify emergency for the pediatric ambulance service. He qualified for just the patient transport service. So the girls brought up a car seat on the thing and they took him to Monash and I went with him and my husband drove. And the way that Monash is set up, you can't get to the Children's Hospital with an ambulance. You have to go to the ambulance bay and then walk the patient into the hospital. It's quite funny. So we stayed there. He had a CT from a lung doctor, a respiratory doctor. And we spent Christmas Day in there and he didn't have the CT till the 27th because they have skeleton staff. They didn't have enough people to deal with emergency and booked in stuff. And then the doctor came in and said, he's got a special chronic lung disease called neuroendocrine hyperplasia of infancy. And it's not your fault. It just happened. He just has it. And I always wondered in the back of my mind, I had a C-section. They clamped his cord within seconds. Maybe he didn't get all of his stem cells, all of his blood, all of those healing things that come from his placenta. And maybe that's what caused this. And I asked the doctor, well, I had a cesarean. Do you think that would have contributed? And he said, maybe. It's known that the infants with this disease, they often are born by cesarean. I went, okay, well, not that that's the total cause, but I made that connection. I connected the dots a little bit there. So maybe that was the cause, maybe it wasn't, maybe he was always going to have this disease. So we brought him home. He was on oxygen to sleeping at night for about 10 months, and then he was fine. And he's been fine since. He's 3 now. And he sees the lung doctor once a year. We've been downgraded to once a year appointments. And he is the healthiest 3-year-old you'll ever see. You wouldn't even know that he was unwell.
I'm glad to hear that. I'm really glad to hear that. Yeah.
Yeah, and it could have been a lot worse, but we managed to get the disease that is very manageable, very treatable. We don't have to do any drug therapy. It's all just oxygen support if he needs it, and he will live a full life. It's not going to He's not going to impede on his life cycle, which is nice. He's not going to be an athlete, but that's okay. I don't mind.
So,
but then we started to think about a second child after that.
Let's talk about the second child and, you know, your plans in your mind and how your birth.
Well, we knew that we didn't want to try for another baby until James had come off the oxygen support. I didn't want to tangle all of that up. I didn't want to be looking after myself and looking after this baby that may need to go back to hospital at any point. So we made the decision together that we would not try for another baby until he was off that. So he became off that at 15 months old. So we went, right, that's it. Let's have another baby. We always wanted them close together. We wanted them between sort of 2 and 3 years apart, but not under 2 and not over 3. So we had that year, and we knew that we wanted another baby in that year. So that's what we did. We tried really hard and we got pregnant, which was nice. And I hadn't really thought about, I knew that I wanted a VBAC. I knew that very soon after James's birth. I didn't have any, I knew I didn't want another cesarean unless it was a planned one for a reason, or an emergency one for a reason that I knew was a reason, not just because they said it was a reason. And I knew that I didn't really want to go back to that local hospital, but I didn't really have any other choice, because otherwise I was going to have to drive an hour and a half, 2 hours to either Dandenong, which is about an hour and a half from where we are, or Casey. And Casey is really hard to get into. They're very tightly zoned, so I wouldn't be able to get in there. And then otherwise I have to go to Monash. And Monash is a tertiary level facility, and if I didn't have anything else wrong other than a VBAC, then I wasn't going to be accepted there. I didn't really want to go there anyway. Too medical, too much. So got pregnant, went to my GP. It's been part of the home birth group, had been part of the VBAC group for a long time in between these births, and knew a lot of stuff. Had this aggression, had this passion to make sure that I had the best birth experience I could possibly muster. So we did the normal thing. We went to the hospital. I had my blood pressure was a little elevated. So he had to refer me, according to their rules, that he had to refer me to the early pregnancy clinic because he couldn't care for me as part of a shared care provider of the hospital, because that's the hospital's rules. Does that make sense?
Yeah, definitely. They have their limitations, just like midwives, home birthing midwives, they have their limitations on when they have to. So their partnership with the hospital prevented him from looking after me after it got to a certain point. It wasn't super high. I think it was, I want to say 150 over 90 was my highest reading, and normally it was 120 over 80, like religiously. So it was a bit, and I felt terrible. I was sick. I was vomiting every day, sometimes twice a day, or just because there was dirty dishes in the sink, or just because I had to brush my teeth. Like there was, it just, and the smell of the laundry powder. Oh my God, it was terrible. And our laundry is in our bathroom, so I couldn't escape it. And so I felt terrible. I was probably fairly dehydrated. I couldn't keep anything down. I didn't want to eat, but I made myself eat because I knew I'd feel better after eating. Just that vicious cycle of that first 12 weeks. So I was at the hospital at about 13 weeks. No, 12 weeks. It was the day of my scan. And he estimated my due date on September 25th, I think. Yeah, so he estimated my due date September 25th. And I went to have my scan and they estimated it, he was later than that. So my scan put me ahead 5 days of his estimated due date. And I went, I knew that if they had my scan at the hospital, if I had that information, I would likely be pushed to have the estimated due date that was the earliest one according to the scan, because technology rules the school. So I purposely booked my scan for the morning of my midwife appointment, and I knew they wouldn't get the information in time. So I had the scan and I went to the appointment, and she calculated my due date 3 days prior to the scan. So I took the date that she made, I think, or the one my GP made, which was like the 30th of September. And it was 5 days later than the scan said. And I went, that's my due date. There you go. She said, yeah, I'm fine with that because it's only 3 days off the one that I've calculated. So that's fine. And so she took it and she ran with it.
And I ran with it, and I said that was my due date. That was it. There was no more talking about it after that. And the scan results didn't matter. They didn't even get to see them. So she referred me off to the OB because I wanted to have midwife care. I said I wanted to have midwife care. And she asked me, what would you do if you didn't get into midwife care? And I said, get my own midwife. She kind of just ignored me. She just turned around and started typing on the computer.
Is this the obstetrician that said that?
No, this is the midwife.
Ah, okay.
In the hospital.
Yeah.
At the early clinic.
Mm-hmm.
And so she referred me to the obstetrician. And I think between appointments, I went off to see the Birth Without Fear conference that was happening in Melbourne.
Mm-hmm.
And I heard January Harsey and Simone Stone and Andrew Gallo and someone from Hypnobirthing Australia, and they all talked, and it was a really great day. And I urge anyone, if it happens again, go. It's really invaluable hearing all those professionals talk.
Yeah, it is.
And that's when I knew that maybe I wanted a home birth.
Mm-hmm.
And I toyed with the idea in our first pregnancy. I said, oh, why don't we have a home birth, like as a joke, to see how my husband reacted. And I went, oh, no, we can't do it. We're too far from the hospital. Ha, ha, ha. Like, yeah. So it's always been in the back of my mind. It's always been a possibility for me. Maybe not a possibility for my husband so much. He didn't really care, though. Didn't care too much about it. So I had this in my mind, and I went to an obstetrician appointment, and she said, I don't see why you can't VBAC. And then she said, but you have to, and listed off all these things that I couldn't do. I had to have continuous monitoring. I had to go into spontaneous labour before 41 weeks. I can't push for more than an hour. All these things that I have to have. I couldn't get in the bath. The baths are separate in the rooms at this hospital. They're not in the birth suite. They're in different rooms. There's 2 baths, one for labouring, one for birth. There's no way I was going to get into that bath. She was not going to let me, ever. So I said, okay, well, she's like, what do you want to do when you get to 41 weeks? And I said, I don't know. Cross that bridge when we get there. I was only 17 weeks at the time. I said, I don't know. I said, I'm never being induced again, though. She said I couldn't have an induction to start with. And then I said, oh, I'm never being. She said, oh, well, what about 41 weeks? And I said, no, I'll just wait. I'll see what happens. She said, oh, well, you can be induced then. I went, no, I'll never be induced again. Never, ever, ever. You couldn't talk me. You couldn't pay me to be induced again. She said, oh, okay, all right. And I said, if I needed to, I'd have a cesarean if my baby needed to come out. If he absolutely needed it. I knew it was a boy by this stage. I just had a feeling. I knew. And so, yeah, she said, oh, okay, all right. And I said, she's like, okay, we have to have continuous monitoring. And I said, okay, well, what monitoring do you have? Do you have just the belly bands? I know about the scalp screw. I had that with my last baby. I thought, well, you're hardly the one should be giving me the guidelines. You've only been here 2 weeks. But you're the one that I'm seeing. Okay. Have you even worked on the birth suite? Do you even know what's up there? Like, it just really threw me way off into this rage of, you don't even know what's available here to me. You can't give me adequate advice. So I went home and I looked at the information written on my sheet that she put in my book, and she typed on the information, we'll have a C-section at 41 weeks if no labour. I thought, no, that's not what I want. I nearly called the hospital and nearly yelled on the phone, but I decided, no, it's okay. We're going to have a discussion with my husband tonight about home birth and see what happens. So we had the discussion and we were laying in bed, and I said, I really want to birth this baby at home. I don't want to go back to the hospital. I don't want to do what we did with James again. I can't handle that, and I don't think you can either. And he said, no, I don't want to do that again, but if you need to have a C-section, then you need to have a C-section. I said, yeah, but I could still have a C-section even if we planned a home birth. It wasn't home birth or die. It was home birth or transfer to hospital for care that I need. And he went, okay, well, I can't stop you. You know, I think that you know what's best for you, and I'm not going to say you can't do it because you're just going to do what you want to do anyway, which was true. I was going to do whatever I wanted.
He knows you so well.
Yeah. Yeah.
That's
like,
good.
just because I'm a little bit scared doesn't mean you're not going to do it. I said,
yeah.
We can fix that. Let's speak to a midwife. Let's find out what it's all about, because we didn't know anything. I didn't know enough clinically about the guidelines or anything like that. I didn't know any success rates and or what risked you out of home birth and what didn't. So we spoke to a midwife. I called Melbourne Midwife Collective and I emailed them, and she put me on to one of their midwives, Emma. She came and spoke to us and said, oh, well, there's no reason you can't. What do you mean your BMI is high? Because that's the hospital said my BMI was high with this one and with the last one. And she's like, what is it? And I was like, oh, it's a BMI of 35. She's like, oh, that's fine. If it's not over 40, we're in business. Like, great, we're fine. Because I weighed exactly the same as what I did before I was pregnant with James, as when I was pregnant with Charlie. Because I didn't weigh myself in between. I just weighed myself when I needed to go to the pregnancy appointments. I don't weigh myself religiously. So she's worked us through what happens, and, you know, there's only a 1% emergency transfer rate, and these things mean that we would support you in hospital, and these things we would recommend that you transfer, and da-da-da-da. And Tom just totally melted away. He just went, oh, okay, this is not, it was really just fear of the unknown. It was not fear of birth itself, it was fear of the unknown. He didn't know what was going to happen if things went wrong. So we discussed where the ambulance was and where the hospital was and all those things, and they all met the criteria that we could be in. So in between speaking to Emma and hearing again from Emma, we decided we definitely wanted to do a home birth. It's only a couple of days, maybe a week. Probably about 18 weeks, 19 weeks now. My 20-week scan was already booked at the hospital, which I was a bit annoyed about. I should have gone somewhere else, but too bad. I was going to go to the hospital to start with. And Emma rings me and she says, I'm actually taking a job to run the Launceston Birth Centre in Tassie, so I'm not going to be able to put you through with me, but I can refer you on to someone else who's in our group. So she referred us on to Louise, and we met Louise, and it was just meant to be. She was the most kind, soft, warm, motherly figure that I felt I needed for this birth. I needed that nurture, even though I do have my own mother here. She was going to be here for the birth, but I needed that professional nurturing. And she met us, and she came to our home and saw our place and whatever, and spoke to us, and we went through my last birth and everything, and then she left. And then I said to Tom, this is it. If Louise is available, we're taking her. And she was. So I said, great, book us in. And as soon as I confirmed that she was going to be our home birth midwife, all of that stress and anxiety that I was holding, which I didn't even know I was holding, just vanished. And it just turned into this elation and this joy of, I'm excited about having this baby now. I really feel like this is entirely the right thing to do. Even if we do end up at hospital, I feel like I have the right care provider, that I can make the right decisions, and that I can stand up for myself and say what I want to say and do what I want to do instead of just being told what to do. I wasn't going to be told what to do anymore. So we booked her in, and that was at about 18, 19 weeks, and we planned our home birth from there. We met our second backup midwife, Amanda. Everything was lovely with her. She did exactly what I wanted for my birth. Totally believed in the woman's body and all that stuff. So that was exactly what we wanted. And my pregnancy just went swimmingly. I enjoyed my pregnancy. I had no stress. I had no anxiety. I did a bit of walking every day. You know, I had a toddler, so I couldn't sit down on the couch all day like I may have wanted to. So I was actually up and active a bit, which was nice and probably helpful. And yeah, my BMI didn't really change. I didn't gain a lot of weight. I didn't really weigh myself, but I may have weighed myself towards the end, but I can't remember what it was. And yeah, so off we went. And it wasn't until 36 weeks when we had I passed my glucose tolerance test. So I was able to birth at home because I didn't have gestational diabetes managed with insulin. So I decided, we had our birth meeting at 36 weeks. Both midwives came, Louise, Amanda, and my husband and my mum all came, and we sat down and we talked about what would happen, you know, and if my waters were to break because my baby was again high, he wasn't engaged, which I knew wouldn't happen because subsequent babies often don't engage. My first baby didn't engage, so of course he wasn't going to engage. He was a smaller baby. I joked that he was going to be over 10 pounds because my first, you know, the wives' tale that all the babies after your first one, they only get bigger and bigger and bigger. Well, that was a lie. He was not 10 pounds. He was only 8 pound one, teeny tiny. So we kept going and had the birth plan meeting and went through everything that would happen. And then I trudged along and I just was waiting for labour to begin. And I expected to go to 41 weeks because I knew that that's probably, or at least over 40 weeks, 40 weeks, 5 days, 40 weeks, 6 days. And I got to 39 weeks, 6 days. And I was having this period pain, and I didn't have any Braxton Hicks really. I had maybe a couple here and there, but I think that was just when I overworked my body more than anything. I was just tired or dehydrated. So we went out for the day, and I felt a bit crappy in the morning. I thought, oh no, this will just pass. I'm probably just preparing for labour. You know, it's probably coming eventually. I'm not going to be pregnant forever. Just ignored it. We went out for breakfast with our toddler. We went to the shopping centre and picked up some stuff. We came home. We played outside. It was just a really nice, sunny, beautiful day. And we were just really, really happy as that family of 3, knowing that we were going to be a family of 4 at some point soon. And my toddler, we had a shower. My toddler had a shower with and then with my husband. And he went to bed. And this is about 8:30, 8 o'clock. And I'm standing in the kitchen and I'm going, Tom, I think these are contractions. And his face just fell to the floor. It was so funny. I remember it so clearly. And he was sitting on the couch and he just went, what? I went, yeah, I think I'm having contractions. And so I sort of, was timing them a little bit just to see how far apart they were. And I was like, okay, well, we should probably call our midwife and just see what's going on, see what's going to happen. So I called Louise, and Louise said, I'm actually with another woman at the moment, so I'll have to call Amanda and see what she's doing. I was like, oh, great, this is falling apart. But I was like, no, just keep calm and keep going. Maybe it's not going to be anything. Maybe it'll fizzle out. I was dead set sure it was going to fizzle out by the time I went to bed or early hours of the morning. But it wasn't. 8:30, and they were coming, and I was coping fine. I was actually really surprised that they weren't painful and they weren't horrible and terrible like people talk about. And I just thought, well, this is okay. I can just focus when they're here, and then I can do what I need to do when they're not. So I did. I stood up on the couch and I put my affirmation cards up in the lounge room, and we rolled up the rug that was on the lounge room floor, and we put down the foam mat, because we got the tiles, so I didn't want to put the birth pool on the tiles and make it get cold too quickly in case I wasn't in it straight away. And Amanda called me and she said, how are you going? What's going on? I said, definitely having contractions, just not really sure where we're at. I don't know, I haven't done this before. And she said, okay, well, get a timer and time them and send it to me and I'll see what they are. And she lived an hour and a half away. She lived in Inverloch. So she had to drive a fair distance to get to us, so I didn't want to leave it too late. And I said, it's okay, we've got a bed here if you just want to crash here. She's like, I'll sleep in my car. And I'm like, no, that's fine, we've got a spare room. So I timed them, and they were coming at 4 and 5 minutes apart, and they were lasting about 35, 45 seconds. And they talk about when you go to the hospital, and the one timer I downloaded, I shouldn't have downloaded it, and it didn't give me the times. I just timed a few contractions, and then it said, okay, go to the hospital. I went, what? No, you didn't even show me the time. So I deleted that app and I got down a new one, all in like 5 minutes. And the contraction time, I sent that to Amanda, and Amanda's like, all right, well, I'm coming, and I'll ring Renee because she's got to come. And I hadn't met Renee because obviously it's now our backup midwife. So that's pretty funny. Mm-hmm. And I don't know what the conversations were like between Louise and Amanda, but I imagine they're probably like, oh my God, what's going on? This doesn't happen. Yeah. Because Louise primarily attends home birth, and Amanda I think she works in a hospital, and she works as an independent midwife.
Sure.
So it was interesting. So I just went about my business. We put the flags up. Tom inflated the pool. My toddler's in bed in like literally the next room, very close together. He just slept the entire time until I was yelling a bit in transition. And I hopped in the shower, and then I hopped out again, and I sat on the toilet with this little toddler stools under my feet, and that was really intense, but it did the job. So I stayed there only for a few contractions. I'm like, I can't stay here any longer. I have to stand up. And then I was sitting on the fit ball, and I said to Tom, we need to put the water in the pool. And he's like, no, we don't, not yet. And I said, put the water in the pool. So we did it. And we bought we're on tank water here and pump, obviously. And we had one of those stupid old style boiler system hot water units, and bought a portable LPG hot water heater thing, and you run the water into it and it heats the water and then it runs the water out. So we just set that up at the back door, and he ran the hose and the water ran into and you can set the temperature. So we set the temperature for like 20-something degrees or whatever.
Where'd you get
Probably a little
that
bit too hot,
from?
actually.
Was that just from Bunnings? Yeah,
It was
do you know how much
amazing.
it was?
Yeah.
Do you know how much it was roughly?
I think we paid about $150 or $200.
Okay. So it
may have
runs
been
the
a bit
water
more.
through,
It was
keeps it
like
nice
the
and
older
warm.
model. Yeah, so it's like an instantaneous hot water, but it's just a smaller, compact version, so you can take it with you. Most people use it for like camping and stuff. So we got one of those, and it was really great. And Tom just set the temperature, hung it on the back door, and off it went, because obviously it's got to be outside. So yeah, so he ran, because it was only sort of 5 meters from the back door to the lounge room, so he just ran the hose from there and filled up the pool. And then in the meantime, I think it's about 11 o'clock, and Amanda arrived. And I think Renee arrived after that. And so I met Renee, but it's all a bit of a blur. I was really in the zone, just sitting on my football with a heat pack on my back. My mum was there. I said, I'd gone up to her house and I said, oh, we're ready. Everything's happening. And she's like, okay, all right then. So she came down and she made cups of tea and fed people and did all that motherly stuff, which was really nice, because Tom wouldn't have thought to do that. He wouldn't have done. He's not an entertainer. He wouldn't have looked after them the way that my mum did. So yeah, they came and she used the Doppler and found, baby's fine, everything's okay. Did the general stuff, had the Doppler before a contraction, then during a contraction, and then after contraction for a couple of seconds. So he was coping and recovering okay, and he was. Everything was fine. I felt really calm. I felt really focused when I was just to that point, 11 o'clock, 11:30, where I had no concept of time anymore from about there. And I didn't have a cervix check yet. I waited until I was in the pool. And I was back in the bathroom eventually, and Renee came in and she said, how are you going? And I said, is this my plug? And I showed her the toilet paper from where I wiped, and it was all like that jelly, blood streaky plug, mucus plug. And she's like, yep, I had my baby a couple of hours after that. And I went, oh, okay. I was dead set. I was going to see daylight. It's only 1 o'clock by this stage. So she's like, what, do you want to get in the pool? And I went, oh, all right, if you think I should, sure, I'll get in the pool. I might have to get out later if things slow down, but okay, I'll hop in the pool. So, oh my God, getting in the pool was amazing. Everything just melted and seeped and eased, and I felt so relaxed in there. It was really, really nice. And it was set up in our lounge room in front of our fire, and everyone was sitting on the couch. It was really nice. I stayed there, and I had no concept. I thought I was there for hours, but I really was only there for half an hour before my waters broke. And it actually almost hurt a little bit, because obviously I was so dilated, and the bag sort of popped outwards because he was obviously not engaged, so there was still room underneath him with the bag and stuff. And it popped out and came out the bottom, and I was like, oh. And the midwife's like, oh, there's the waters, it's broken. I said, oh, that's nice, that's really good. I'm so glad. And I went back into my mind and was listening to a bit of music, a bit of Diva Primal stuff that I'd got from pregnancy yoga, which I'd done with both babies, more for the interaction with pregnant women more than actual yoga, but I really enjoyed it. And he was coming, and I thought, oh yeah, I'll probably be in here for hours. I'll probably have to get out. And I just kept going and took each contraction as it came, and I sort of got to a point, and I was sitting over the side of the pool, and I said, I just can't do this anymore. But what I'd said and what my mind said, I was like, no, I can, I'm doing it. Like, everything's fine. Everything's fine. Why did I even say that? I don't even mean it. But I couldn't say anything else after that. I just said it, and then that was it. And everyone's like, okay, we're getting close now. And Tom's holding my hand, and every time he spoke, I swear to God, I just lost my focus. Next time I'm going to wear headphones, because I was so in tune to where he was and what he was doing, and every time he spoke, I felt like I had to listen to what he was saying. But he was just chatting with our midwives and with my mum, and every time it took me right out of my focus, and I nearly told him to shut up. I nearly told him to go in the other room.
Yeah.
Next time I'm gonna. But I was just so in myself that I just felt like I couldn't. I didn't have the energy to spend on that. Felt like I had get through. I was probably in transition about now. It's probably about 2 a.m. It's only been half an hour. So water broke. Really, it felt like hours. Felt like hours and hours and hours. And I was starting to get a bit yelly, and I could hear my toddler crying. So my mum went in there, He's only in the other room next to us, so it's not surprising. But I think there was probably a bit of an energy shift too, so I don't think it was just the noise. I think that he woke up because he felt the energy change a little bit as well. And I just couldn't get comfortable. Like I couldn't stand up either. I had to get on my knees, and I was laying back a little bit on my back, and I couldn't get comfortable. And I'm just like, couldn't get through these contractions. I was dying towards the end. I was just losing my mind. I felt out of my mind. I felt out of my body. I felt like I was watching from above. It was just, I didn't even feel like I was there. And Amanda said, "Oh, well, how are you going? Do you want me to check how dilated you are?" And I said, "Yeah, actually, I really do. I don't know where I am. I feel like I need to know where I am now. I feel like I really needed that knowledge, whereas prior to making our birth plan, I was like, nah, don't need it. I don't need to know. Don't tell me." But I really wanted to know. So she's like, "Okay, well, you're fully dilated." And I went, "What? You're fully dilated, but you've got a bit of a cervical lip here, like a little lump. So just pop over onto your all fours or onto your knees, and that'll probably fix itself." I went, "Oh, okay." And it wasn't until later, and I went, "Cervical lip? Like, a lot of women have a lot of trouble with these cervical lips." A lot of people think that that's an obstruction to get your baby out, but it's really not a lot of the time.
Yep, so many.
Oh no, it's obstructed. The baby can't get out around that.
Mm-hmm.
Well, he did. He came out, so I could feel him. I didn't feel him move through my pelvis, but I felt him press against the opening of my vagina. I didn't feel him come through my cervix at all. And I thought I would. I thought I would feel all of that, but I didn't. But I knew where he was intuitively. I knew where he was. And I put my fingers inside of my vagina, and I sort of felt, and I thought, "Oh, he's not there yet. Okay, we're not there yet." And then the next time I did it, and Amanda's like, "Just check again. Is he there?" And he was there. I could feel his head with my fingers, and it was soft and squishy. And I was like, "Oh my God, he's just there. He's just there." And then he pushed against the opening of my vagina, and it burned. Nothing can prepare you for that. There's no pain that's like it. But it was a manageable pain. But my body was pushing him out, but I just sort of got a bit impatient. I said, "No, I just have to get him out." So the second time he pushed against me, I just held him there when the contraction finished. And then before my contraction started, I sort of pushed him a little bit, and then the sensation was gone. And I was like, "Oh my God, he's gone back in. He's gone back in. He's never going to come out." And my midwife's like, no, his head's out. He's here. I can see his head. And I was sort of in a position leaning forward on my knees so they could see him sort of out the back of his head, just under the water. And the next contraction came, and I pushed again, and he just came out, and my midwife caught him because I'm facing the wrong way. I should have faced the other way, but next time I'll do that. He caught him and sort of unwrapped him, and then gave him to me. But gave him to me so the cord was like under my leg or over my leg. I can't remember. I must have been under my leg or over it. And I felt like I couldn't move, but I just burst into tears when he was born. I burst into tears, and I held him against me. I went, "Oh my God, I did it. Oh my God, I did it." And both men was like, "Yeah, you did it. He's here. He's right here." And so he arrived, and Mum brought my toddler out to see it, and my husband saw, and everyone was standing around, almost cheering. Like, that's how elated I felt. I felt like people were cheering. Like, I was so happy. And it was amazing. I'd had these dreams that he'd been born at night, or I'd go into labor at night. I was like, no, maybe it's not. Maybe I won't. Maybe I'm just imagining it. That happened, and he was born at 2:26 a.m. And I didn't even see the daylight like I thought I would. So from start to stop, it was about 6.5 hours. Which, I mean, I thought that was pretty good considering I'd never laboured spontaneously before.
So from the start of everything, it was 6.5 hours.
Yeah, so I had
prenatal
all day, which was manageable, but from clear contractions, at 8:30, it was about 6.5 hours.
Well done.
Yeah, thank you.
You surprised yourself.
Oh, I did. I really didn't want to over-prepare my mind for best case. Does that make sense? Like, yeah. I didn't want to be, I knew that adrenaline would work against me. And I knew that wouldn't allow my hormones to do the job that they need to do. So I didn't want to get too excited or too anxious. And I just went, what will be, will be. And that's what I think will happen. If it happens, great. And if it doesn't, great. You're still going to be born. So, yeah, he was born, and I was sitting I had a meconium standing again with my second baby when my waters broke. You could see it in the water. And at that time, we made the decision if he was fine during and after and before a contraction on the Doppler, then we wouldn't transfer. So we didn't transfer because he was fine. And he was only out an hour later. He was absolutely beautiful. He was fine. He was pink. He had a great APGAR. I don't remember what it was, but it was great. And so I was bleeding quite a lot holding my baby. I felt fine at the time. Looking back, I felt absolutely fine. And my mum took some pictures, and my husband, invited James to meet the baby. And then he put James back to bed. And at this time, I was sort of, the midwife like, oh, you're bleeding a bit much. I'd probably like you to get out of the pool. So I got out of the pool. I was a little bit confused because the cord was somewhere, and I feel like I couldn't move my leg. So I was like, how do I untangle this? I couldn't work out how to move Charlie around my leg to untangle me from the cord. So I climbed out with some help because those pools are really tall, and I'm only 5 foot. So it's hard work to climb over the side of the pool with a baby in your arms and a cord between your legs. But I managed. And I laid back on the couch, and I was still bleeding quite a bit, and I stood up a little bit and more blood came out. So we made a decision to manage the 3rd stage. My placenta hadn't been delivered yet. So I had the syntocin injection in my leg, and I sort of squatted a little bit, and the placenta sort of just fell out, which was great because that was what we wanted to achieve. So then the placenta was put in a bowl, and I was laying back on the couch with my beautiful baby on me, with a towel over us. It was very nice. I really loved it. My mum heated up some frittata that I had made the week before, and I put in the freezer. And she heated it up for me in the sandwich toaster, like I'd said, and then she sat on the couch next to me and she fed me a little bit. And then she had to go somewhere else and do something, I don't know what. And then Renee, my second midwife, she fed it to me. And I was pretty sure I wanted a glass of wine because I'd really missed red wine that pregnancy for whatever reason. I really wanted it. But my midwife's like, no, how about have some water first? So I had some water instead. But I was still bleeding a fair bit. So by sort of 5 a.m., I'd gotten up and we decided to cut his cord, and Tom cut the cord and had some cuddle with him with his singlet on and everything. And he's a bit funny about having skin to skin with this mucky baby, with this vernix covered smushy baby. I was like, no, just on my singlet, thanks. So we put Charlie against him and held him, and I had a shower, but I was still bleeding quite quickly on the way to the shower. So I sort of had to walk with a towel between my legs, and I felt a little bit dizzy by the time I was standing up an hour and a half after birth. And so I had some more meds. I had a tablet that went under my tongue. I think I had another injection as well in my other leg. I'm not sure what they were. I'm sure that they were probably standard practice stuff. I could probably tell you if I look back in my notes, but I have no idea at the time. And I had a shower, and I was standing in the shower, and I was holding onto the sides. I still felt a bit dizzy. I felt nauseous, and I didn't know at the time that this was the symptoms of a high volume blood loss. And I think Amanda estimated my blood loss at the time of birth about 700 mil. And by the time we sort of got around to the afterbirth and back out of the shower, it's probably about 1 litre. She estimated it about 1 litre. And it was still bleeding. And I had those meds, and it had been 15 minutes. And so I was lightheaded and I was nauseous. So Amanda said, well, let's pop you on the bed and we'll give you the massage, uterine massage. And then we'll decide what to do. So we decided, I was a bit out of it. My baby was with my mum and with my husband. And my mum had put my dog in the cage, thankfully, because he sleeps in a crate overnight. So she put him in there because it was getting busy. So I had massage, and they tried to put an IV in, but my veins were a bit hard to get into. So Amanda ended up calling an ambulance and said, yeah, well, they were only sort of 12 minutes away, the ambulance. And it ended up coming 2 ambulances, 1 normal paramedic and then a micro paramedic. And I was okay by the time they got there. I felt okay. I felt like I'd come back to myself a bit, laying down in my bed. I was cold. I felt cold. And my midwife had asked my husband to heat up my heat pack. And I had asked him to start packing me a bag. So he was a bit frustrated because all these things were being asked of him. He didn't really know. And I'd packed some stuff, in a nappy bag in case of transfer for the baby, not so much for me, but for the baby, and some pads and stuff, and that's about it. So the ambulance came, and they came into the house, and it's 5 a.m. now. So 5. Yeah, it must have been 5. So he's been born for nearly 3 hours. My mum dressed him and put him in some clothes and a hat and a blanket. And I said, okay. I said, yeah, we'd like to go to the hospital just to get some blood or some fluid and see how you're doing. So by the time I got in the ambulance, I was fine. I was right as rain. I was holding. They were like, oh, the baby should probably go in the catchment. I was like, no, baby's coming with me. no, I will not have this separation again. It's not happening. It will come with me. So we made the trip for 25 minutes to the hospital. I went in the microcam paramedic, but they didn't transfer care. So my midwife was still my care provider when I was in the ambulance. And then when she got to the hospital, she transferred my care to the hospital. But they were pretty funny about the independent midwife. They didn't really listen or acknowledge her status, I would say. I don't want to say they didn't acknowledge her as a person, but they didn't acknowledge her status. I had a really great midwife when I was going into the birth suite, and people said, congratulations. That was really nice. I was walking in on the stretcher and they said, congratulations, and oh, look at your baby, da-da-da. So that was really nice. And the midwife, when I got there, she asked every time she wanted to touch me. She said, Alyssa, is it all right if I just do this for this reason? And it was really, I had not had that before, and I could have cried. And when she was changing over shifts, I said, thank you so much for being such a great midwife. Thank you so much for asking if you can touch me before you actually touch me. And she said, no worries, that's fine. I do it with everyone. And I was like, oh, there's a great midwife here. That's so good. And I was pretty elated still now. My blood loss had stemmed a little bit. I didn't feel like I was bleeding profusely anymore. The obstetrician came in to I think I must have been in a treatment room or I think I was in a birth suite actually. They put me in there and she wanted to have a look. So the stirrups came out and they shone a light on me, and I was pretty sore. It's 3 hours after birth, 4 hours after birth. I was red and puffy and very sore by now. My pelvis hurt, everything was swollen. But she wanted to have a look and she wanted to touch it. And as soon as she touched me, I jumped because I didn't expect it to be so painful because no one had touched me. Like I'd had a tear and a graze because he came out with his fist underneath his chin. So it's a little wider than the sort of the average head circumference by the end of it. And I pushed him out. I shouldn't have done that. I should have just waited for my body to do it. But here we are. You listen and you learn. And so she looked, and I had a tear, a second-degree tear, which I'd chosen not to have stitched at home. I just wanted to leave it. I wanted it to heal on its own because it wasn't the real big cause of my bleeding. Otherwise, we would have looked at it. We looked at it when we were at home. Like I was checked out thoroughly at home, and we only transport to have bloods done and fluid put in. So and product, but you could see that it was all there, but it did have a little bit of breakage, but it was all there. Yeah, so she was looking at it. I was up in the stirrups. That was not comfortable. I don't know how people birth in that position. That was not fun at all. And she was looking and she put a bit of gauze in on my tear, and she's like, if that's bleeding when I come back, we're going to have to take you to theatre. I went, what? What do you mean take me to theatre? What for? And she's like, I want to stitch it right now. And I said, no, you're not stitching it. You're not touching it. It's fine. I chose not to have it stitched at home. She's like, yeah, but it's policy. I have to stitch it. I said, no, you don't have to stitch it. You don't have to do anything. Just leave it alone. So she was pretty grumpy. She was pretty assertive. She left the room and left me with the midwife. And I said to my midwife, who was still with us at the time, and I said to her, I don't know how I feel about this. I feel like my blood loss has slowed. I feel better physically. I don't feel dizzy. I don't feel nauseous. I don't feel cold or hot anymore. I had a bit of a temperature spike, but it came down. I'm not sure really why that happened. And yeah, so I sat in that room with my feet up in stirrups for 20 minutes. She went away, she came back, and they were going to do shift changeover soon. So I was going to get a new obstetrician. And I thought, no, I don't want to have to fight with someone else. I just said to the midwife, can I have a mirror? I want to look at it. And I had a look at it, and it wasn't as bad as I had thought it would be. I mean, obviously I couldn't see the depth of the tear, but I could see the outside. And she said, yeah, no worries, gave me the mirror. And I said, no, I'm fine. I'm just going to leave it. So they made on the top of my hand. Oh my God, she was amazing. I can't believe she got it in so quickly and so easily. It was amazing. Yeah, so they took blood, but did all the, I don't even know, check levels, whatever, check iron, check whatever else I had to do. I had a couple of bags of fluid, 2 bags of fluid, I think, went in. And then I had something to eat and I had a drink and I felt pretty good. I had a baby, so I felt as good as I could. And then they said, all right, no worries, we just want to keep you here till we get the test results back and a bit of observation. So she cleaned up the room and she took me to ward. And yeah, I stayed on ward for a couple of hours. You know, the midwife shift changed again. And I actually got a midwife looking after me who looked after my mum when she had me and my sister at Rosebud Hospital, the local hospital down here.
Wow, that's so special.
Yeah, she remembered my doctor's name and she remembered my mum's last name. So
wow.
that's very interesting. And she was so lovely and we had that little connection like I'd had with my private midwife, which was really nice. And she kept asking, you know, have they come to see you? Have they come to see you? And I said, no, we haven't been seen since we got here. You know, this was 2 o'clock in the afternoon. We haven't been seen. And then shift changed again. And the obstetrician came, or the registrar came. And she said, we have to keep you here overnight. And I said, why? I thought everything was fine. And she said, your liver levels aren't right. And it just was really hard to get all of the information out of her. She didn't give me a number and where she wanted it to be. She didn't give me anything. And she was worried about post-birth preeclampsia or post-birth eclampsia, one of the two. And I'm not sure. She didn't give me enough information and I haven't looked into it enough to know what the symptoms are other than a spike in blood pressure. That's all she was concerned about, and my liver levels, which she didn't tell me they were liver function levels or what. She didn't tell me what it was. She just said liver levels. So I'd spoken to my private midwife. I'd rung Louise and said, look, this is what's happening. They want to keep me here overnight. I'm so tired. I haven't slept since, you know, the night before. I haven't had any sleep. My husband had a nap on the bed in the shared room that we were in, which was nice because he had to drive home, obviously. And yeah, so she came back. The midwife came in. She was a younger midwife. She was fairly new, and she said, I just have to take a urine sample. And I went, why? It's like, to check your liver or your urine or something like that. And I was like, okay. Why do you have to use a catheter? Can I just pee in a cup? Because I hate catheters. I cannot stand. That is probably the most irritating part of the whole experience was the catheter, because she did it 3 times, but it was contaminated every time. So she got the midwife on shift, the head midwife, to do it, and she did it bang done. So I had to lay there with my feet together, exposed, waiting for this other midwife to come. It was pretty funny. I just laugh about it now, but at the time I was pretty annoyed. So I asked her, can you bring that other doctor back? I really want to ask more questions as to why she wants to keep me here. And so she came back and she said to me, you don't really like me, do you? And I just said, well, I've been here since 5 a.m. I had a baby last night. I haven't slept. I would like to know why you want to keep me here. I don't understand. And she said, we want to monitor your blood pressure overnight, make sure it doesn't spike. I said, okay, and what if I go home? And she said, well, if it spikes overnight and then your organs go into failure, there's not much we can do about it. And I went, okay, well, all right. You haven't really given me a way to manage it at home, so I guess I'll just have to stay overnight. And I said, I'm really tired. And then I started to cry because I was just so tired and I didn't want to be there. That's the reason I had my baby at home. So I didn't want to be at the hospital. And she said, all right, well, we'll try and get you a single room and you can stay there. I'm like, okay. So she got me my own room and I stayed with my baby, and no one touched my baby because he was boarding with me. He wasn't born there. He wasn't a patient. No one weighed him. No one undressed him. No one touched him at all. And it was so nice. And then overnight, I had my blood pressure monitored once at about 10 o'clock and then not again till the morning, till I called the midwife in the morning when I was awake at 7 o'clock. So they didn't really monitor my blood pressure overnight, like she said that they wanted to. Like that was the whole reason that I was there. And my liver levels apparently had come down. She finally gave me a number. It was at 50 and it was meant to be under 20 or something like that. So they had to come down. And so I heard the afternoon midwife talking to the night midwife outside my door. She said, they're down to this number, but they're not down far enough. But she didn't tell me that. She told the midwife outside the door that, and I just heard it. Like, no one gave me any information. They just talked to each other, and that was it. It was really annoying because I really wanted the information so I could make a decision as to whether I needed to stay or whether I could go home.
And how were you feeling, like, in your body physically?
I was fine. Absolutely fine.
Mm-hmm.
I was sore, but I was able to get up and have a shower after I had my baby. I couldn't do that before. I couldn't do that with James. You know, it was astounding the level of autonomy I had. I could move my body all by myself. I didn't need any help. I walked from the birth where they examined me when I got to the hospital. I walked from there to the ward room by myself carrying my baby. I didn't get a wheelchair. No one had to roll me in a bed. It was amazing. It was really empowering, I want to say, because I was allowed to move my body. I was able to move my body all by myself, which sounds silly, doesn't it? Because I should have been able to do that after my first birth anyway, but I had to wait for them to say that I could do it, which is silly.
That's what happens, though. Yeah.
Yeah, and all too often. And so after that, I stayed the night and I called the midwife in, and then I was walking around with my baby on the ward because I'm seeing all these new dads with their babies. It was so adorable. And I stayed by myself because I obviously had a toddler at home. So my husband went home and he came back in the morning. And this is pre-COVID. So thank God, because my mum bought me dinner the night before and seen me and helped me and bought some things from home that I'd forgotten. And that was nice.
When did you leave the hospital?
The following morning. So I got there at 5 a.m. on Monday and I left at about 10:30, 11 o'clock on Tuesday morning.
Okay.
Because I called the midwife, had my blood pressure taken. She asked me about my birth and why I wanted to home birth after cesarean. Because she'd have a cesarean with her first child 6 years ago herself. So it was really nice to talk to someone about that. And she was really interested. And then I said, can you get the doctor for me? I'd like to go home. So she did. She went and got the doctor and he came around to my room and he said, oh, wow, you look great. Thank you. I would like to go home. So it's like, yeah, no worries. You just have to go and have your blood pressure checked at the doctor every week. And I was like, all right. My week I was coming back, she could do that. So I went home and my midwife Amanda came the following day just to do all the weighing and stuff. I did weigh him at the hospital. He was 7.4 kilograms. That was nice.
Who is 7 points?
No, that's wrong. He's 3.7 kilos.
Sure.
I knew there was a 7
so
somewhere.
I think that's £8.3.
He's £8.1, I think it turned out to be.
£8.1, yeah.
Oh, £8.3,
I think it is, yeah.
I don't know.
I had a 3.7. I had a 3.7 kilo baby. It was £8.3.
Yeah, so he was
Not
around
that it
an
matters.
He wasn't 10 pounds like I joked he was.
So much smaller than your first as well.
500 grams smaller than my first baby. A longer gestation by a couple of days.
Yeah.
So it was just really interesting. And, you know, because they always get bigger. No, they don't. That's a lie. And your babies grow to the right size that they're meant to be.
And how did you heal in your postpartum with the tear and after a vaginal birth?
I didn't find it hard at all. I was able to get up and out of bed. I spent about a day because I really wanted to spend the first day in bed with my baby and my family after the birth. But I hadn't visualized what postpartum immediately looked like for me. So I couldn't see that. I could see I could have my baby at home, but I didn't see what postpartum looked like because I didn't have a normal postpartum last time and I was in the hospital. So I didn't understand. I didn't really know what to expect. And obviously then we transferred. So I sort of expected what to happen at the hospital. So when I came home, I hopped into bed with Charlie and I had a shower and I hopped into bed and everyone was around and that was really nice. I don't think we had any visitors that day. I think we had visitors the following day. So that was really nice too. We didn't have any unnecessary interruptions. And Amanda came back on the 2 days after he was born and, you know, did all the blood sending off, you know, the blood pricking and stuff. And all the newborn checks. We decided to have the vitamin K injection because I'd had that bleeding. I didn't want to, I don't know, somehow transfer that type of thing because I had all that bleeding. I didn't want to worry about that. So I decided that I was going to do that. But I didn't do the hepatitis vaccination. I just left that till the 6 weeks. So that's what we did. And we spent the day at home and we stayed home after that. And I was absolutely fine. By 2 weeks, again, I felt like the tear was pretty much completely healed. I actually, after sort of a couple of weeks, and I'd stopped bleeding. I think I bled for about 5 weeks this time, whereas with my C-section, I only bled for 2 weeks, obviously because I didn't have a natural delivery. They scooped everything out. So I actually made my husband look when I stopped bleeding. I was like, can you just look at it? I just want to, does it look the same? Like, I don't know what it looks like. You look at it more than I do. Can you tell me what it looks like? He's like, yeah, it looks like normal. It looks like you didn't even have a baby. I'm like, well, that's all right. Pretty glad with that. So, yeah. So, and everything felt fine inside. I sort of felt around, is there any sore spots or anything, but it was fine. And I didn't have any of that hormone drop or that baby blues. I was just happy. I was so happy, and my milk came in more gradually and a bit faster than it did. It wasn't like a big smack into the milk overnight. It was like gradually it came into bursting, and it was just, and he fed pretty well. He had a tongue tie like James did, but his was more severe. So we had that lasered at just the end of 2 weeks old, and he fed much better after that. There wasn't any trauma to my nipple though. It was mostly just he was falling asleep at the breast and he had a lot of wind. So my car referred us to the laser, and we had that done by the dentist. And that was, I wish I had had that done with James, just to get rid of the tongue tie, so I didn't have to worry about, is it affecting his speech? Is it affecting his weight gain in the long term? But oh well, I'm not going to do it now. And he's 3, so there's no way he'd sit at the dentist and have it done. But yeah, it was just worlds apart. The whole experience was worlds apart, and I would do it with the transfer again and again and again.
Yep. Oh, that's great.
Yeah, and I mean, we plan to have another one probably, maybe not next year, the year after. And I plan to have another home birth. I don't see why not. I would love to do it again, and I would love to stay home after birth. I would like to improve again and see how we can make that happen. But yeah, I was just really, really, really happy, and I still feel the joy and the elation and the ecstasy that birth brings me and brings him. And he is a healthy, happy baby. Yeah.
See that with how active you are in the VBAC and home birth communities. You're a huge advocate for,
I feel so passionate about this. I want other women to feel the way that I feel about their second or subsequent birth after their cesarean.
Oh, well, thanks for being such an awesome advocate for VBAC women, and for sharing your stories today.
Thank you for having me.
Thank you so much for coming on.
No problem. I'm really glad that I was able to share. I've been wanting to share it for a little while now.
No, I'm so glad. Thank you so much.
No problem. Thank you for having me.
Hey, me again. I just wanted to let you know that I've just created a brand new Facebook group called VBAC Home Birth Support Group, where you can connect with other like-minded mothers who are looking to have a VBAC home birth as well. You can find the link in the show notes, and I look forward to seeing you there. Thank you so much for listening to the VBAC Home Birth Stories podcast. I hope that this episode has helped you take another step to finding your voice and confidence in your VBAC journey. If you enjoyed the episode, please take a second to rate and review. Each review helps us to help more women to find out more about VBAC home birth, just like you. Don't forget to take a screenshot, share it to your Instagram stories, and tag me at the Motherhood Circle. See you next week.